Thank you, Alexander Vasilievich. If we speak shortly about the goal of my presentation, I will give a review of what is happening in our country and in the world, because there are very many changes. Some news is always on the agenda, which is very good. You know, the time of my presentation will not allow me presenting everything that has taken place, but I would like to speak about the main things. So the latest news, what is happening in the world among the leaders of this area, the United States and the European Union. They have different approaches to the problem, but their strategies are similar. As to FDA strategy, it is creating guidelines of RWE use, and they have advanced more than we have. And in September, recently in September this year, FDA published a guideline for those companies who sent their drugs for registration, and the document defines
identifies in which cases the real-world data can be used, let's say post-marketing studies, etc., and the arguments how to use this data. Also last year, quite recently in spring, FDA issued a very interesting initiative that is a standard for the organization of the patient registers, some criteria, assessment of qualities, etc. And this is a very interesting document which requires studies and possible implementation, well, partial implementation for us, because as we spoke in the previous session, that is the topic which is not yet quite well regulated. If we speak about the European Union strategy, we see interesting things as well. And also this year, back in May, European Commission launched a project. This is so-called European Health Data Space. European Health Data Space. And they published the way of working. So these are standards of the collection and transfer of the data for the whole European Union, which is, you know, sort of overboard document, which is interesting. And as a continuation of this initiative, already in Q4 2022, they launched 4 pilot studies with the participation of regulators. One of the projects is Darwin, and there is a lot of big interest there. A lot of interest is demonstrated towards Darwin. This is a project which starts just this year, but finally it should go in full regimen in 2024-2025. And already now in Q4, they launch additional projects in the European Regulatory Commission on Pharmacovigilance. That includes also Commission on Orphan Diseases, on pediatric indications. Also, there is a number of projects for the development of interaction with the Association of Healthcare Assessment, Healthcare Technologies Assessment, HTA. Another interesting topic which we should look at very attentively and should follow and definitely copy-paste the experience, including, by the way, a regulatory experience. But if we take globally those blocks that international initiatives are focused on, so these are the following. So first is safety. First and foremost, safety of using the data, then the order of data transfer, then standardization, which is important because, well, definitely data and the challenges we face and data storages that accumulating the data and store the data, they normally are not connected with each other because there is no common standard. Definitely legislative confirmation, because without that it is not possible. Then validity of data, establishing the register, and all that is actually focused on the facilitation for the launch of innovative treatments. And actually it fosters dramatically the topic, and COVID actually fosters all that. COVID, which is still ongoing in different forms. And by the way, looking at the results of one of the commission, they actually decided that actually the second use of data, the data which was accumulated, the data on the real clinical practice, could save about 25-30 billion a year. So Europeans, they account everything. So, and that savings could be 50 billion euros for the next 10 years here. So the reuse of data. So that means these are not only huge costs for the implementation of real world studies, but finally it could be quite a big benefit and quite a big saving. Not only from the point of helping the patient, improving the care, improving the quality of using medical technologies, but also purely financial benefit. What happens to us? As we said before, and actually we already talked about it in the previous conference that was reported, but what is good now that we have really some breakthroughs here. We don't yet experience the common register and the roadmap, and the procedures of data set assessment are not also fixed, and we have no common reglement. And with the current legislation, yet there is no mentioning on what it is. But what is very good here is a very good step forward. And the breakthrough is done by the organizing committee and by the lead. And this is exactly what Alexei spoke in his introductory word, because at the level of EEU, Eurasian Economic Union and Eurasian Economic Commission, the rules of registration and expertise were published on March 17. And there we also see the mentioning on terminology. We also see the mentioning that registration certificate holder should inform about the RWD RWE data. So these first steps, they have already been done, initiated, and they are visible. They are visible. The third conference, and by the end of that, as you know, Alexei said it before, the resolution is to be published, it will be issued, and it will continue this fantastic trend, and it will be seen not only in the legislation of EU and also at the level of Russian Federation. And another change we saw in 2021, so there was experimental legal regimen. There was an attempt and there were attempts giving terminology and definitions and proper wording and terms of RWD RWE, yet we have no updates and no new data here. But it's good that it is available, and we hope it will be published and some new data will come. Well, speaking briefly on what it is, RWD and RWE, and what are the challenges here. Well, in fact, it's a project where we need synergy of three big pillars, which is methodology, those who are designing and creating these concepts, then IT designers, and finally, legal people. And as we see, If one of the blocks is not working, there is no moving forward, or process is frozen at particular level without moving on. And only common synergy, finally, allows to facilitate the project and to move forward. At the end of my presentation, very briefly, I would like to comment actually what is the advantages of the private company, because that was a discussion at the end of the plenary. Definitely no commercial solution can replace state-based system, but nevertheless, as practice shows, again, the practice from international markets in the big companies, commercial solutions, they allow to find faster solutions. That's why commercial participation in some niche issues could foster the project and provide